Good evening, everyone. My name is Meredith Toohey, and I'm the Nutrition Education Program Manager at the American Nutrition Association, the ANA. The ANA is very pleased to be hosting Camille Freeman tonight to explore what the nutritionist needs to know about vaginal health. Dr. Camille Freeman has been in practice as an herbalist and nutritionist since 2003 with a focus on fertility and reproductive health. She runs Monday Mentoring, a community of practice for Western herbalists and herbally minded nutritionists, and offers private mentoring for highly trained practitioners who need help with complicated cases. Camille is a professor at MUH, where she teaches physiology and pathophysiology. She holds a doctorate in clinical nutrition from MUH, as well as a BA in English from Rice University, an MS in herbal medicine from MUIH, and an MS in physiology and biophysics from Georgetown University. Welcome, Dr. Freeman.
So hello, everyone. Welcome to our webinar on what the nutritionist needs to know about vaginal health. I'm really excited to be bringing you this webinar today. And before we get started, I thought I would just introduce myself to those of you who I don't already know and tell you a little bit about why I wanted to speak on this topic. So my name is Camille Freeman. Technically, it's Dr. Freeman, but I prefer to just go by my first name. I am a professor at the Maryland University of Integrative Health in the Department of Nutrition. And I also am a practicing nutritionist, and I've been in practice since about 2004, 2005, with a focus on fertility and reproductive health. So I've done a lot of work in OBGYN offices. I've worked in a very large fertility clinic supporting people who are going through IVF and IUI with nutrition. And I'm also an herbalist, so I do support people via herbal suggestions as well as nutrition interventions. And I think you'll see some of that woven in here to our time today. So in honor of Women's Health Month, we decided to bring this topic here to talk a little bit more about, as practitioners, what we need to know about vaginas. So before we get going any further, I do want to acknowledge that not all women have vaginas. And of course, some people who are not women have vaginas. So we are going to be using generalizations here, and this content will apply to folks who have vaginas, whether they identify as women or not. So let's carry on. Our plan here for this webinar is, first of all, we're going to talk about the basics, just go over a little bit about what we need to know about the vagina in general. And then we're going to talk about different ways that we can support vaginal tissue and healthy vaginas, which include the ecosystem and the vaginal flora, the membranes, and the musculature and the nerves, which is a little bit less we can do as practitioners, but I did want to mention it for referral purposes. So that is our plan today. So let us jump in and review the vagina. So this will be not news for many of you, but just to make sure everybody is all on the same page. Here we have an image of a vagina. I think it's a little bit funny how when we see pictures in anatomical drawings of vaginas, they're always drawn open. It looks like it's this big gaping hole. And of course, we know that the vagina is typically, the anterior and posterior walls are typically touching. So it's not normally open like we see in this image here, but it does help us to get a little bit of a better picture of what's happening here. So a couple of the highlights here, of course, the vagina is essentially the canal that goes from the outside of the body all the way up to the cervix, which is the lower bit of the uterus that we can see protruding into the vagina here. Now, vaginas are essentially very different from person to person. In the adult, a vagina can vary in length anywhere between about 6.5 centimeters all the way up to 12.5 centimeters. And that is a natural variation in people who were born with vaginas. Of course, if you have a constructed vagina, there can be differences there as well. The key layer of the vagina that we're going to be talking about a lot today is the mucosal layer, which is of course the most inward layer. That wasn't exactly the most clear description, but essentially the mucosal layer is what is externally facing. And this layer is relatively thin. It's only about 25 to 30 layers thick. And these cells turn over really quickly, like most of the mucosa, very similar to the mucosa that lines the gastrointestinal tract. So about every 96 hours, we have an entirely new mucosa. And that top layer, the very single layer of cells at the very top, that's going to shed about every 4 hours. So this is a very rapidly dividing tissue, which is good in some ways when we're trying to make changes here, but it's important to understand that. We also have a muscular layer, and there is also a layer of fibroelastic tissue as well surrounding the vaginal canal. It's important to understand that lubrication in the vagina is primarily coming from cervical mucus. So that's produced in the cervix, which is part of the uterus, and that varies depending on whether somebody is menstruating, if they're in their menstrual years, if they are premenstrual, or if they're perimenopausal or post-menopause. So that's one source of lubrication in the vagina. And then we also have essentially exudate or transudate, it's technically called, which is moisture that is seeping through the walls of the vagina. It's called weeping, and that is another source of moisture. Now, let's talk a little bit about the vaginal ecosystem. So we have essentially a tube going from the outside of the body all the way up to the cervix, and anything that's exposed to the outside world is going to have exposure to bacteria and other microbes as well. And that is the case for the vagina. There is a healthy ecosystem of microbes that typically lives inside the vagina. Depends on where in the life cycle somebody is, what kind of critters you're going to find there. But between the start of menstruation and menopause, you're going to have a very low pH in the vagina. A normal pH for somebody who has begun menstruating and has not yet gone through menopause is somewhere in the range of 3.5. We used to think it was a little bit higher, closer to 4 or 4.5, but it turns out that that is the pH when you have things like cervical fluid or blood or mucus. The actual vagina itself, standard baseline pH during those menstrual years is about 3.5. It's extremely acidic, and that is the way it's supposed to be. That is not a problem. There are more than 200 different species of bacteria that colonize vaginas, and primarily these are Lactobacilli. That is the most common genus, and there's lots of different variations, lots of different types of Lactobacilli that will be found there, and some of that depends on your environment. There seem to be differences between people who are Black, people who are white, people who are Hispanic, and so forth. So there are some either cultural or environmental differences in the types of bacteria that we might find there. Overall, there's actually less variety in the bacteria found in vaginas than there is in the bacteria we find in the colon. So that's interesting. However, the bacteria that we find in the gut is key in terms of determining what bacteria we find in a vagina. And that makes sense when you think about the anatomy. If we go back to this previous slide, we don't see here on this slide the anus, but you all know that the anus is very close to the vaginal opening in this particular anatomical setup. So it is very common for flora from the anus to migrate into the vagina and affect the composition of the flora in the vagina. There are other interactions as well, which we'll get into in a little bit later. So there are an awful lot of organisms that live in the vagina. And one of the things that these microbes do is actually maintain this low pH that we talked about before. So we have glycogen in the vagina, which is produced by the epithelial cells, and the bacteria that live in the vagina actually eat or use that glycogen and produce lactic acid, which keeps the pH really low. So it's important for these bacteria to be present to maintain the low pH. When we have a low pH, what that does is it prevents other organisms, potentially pathogenic organisms, from colonizing or growing in the vagina. So that's essentially part of our innate immune system, our innate defenses, is keeping a very acidic pH in the vagina, which keeps the organisms in check and prevents infection. And that's really important. Okay, so That's the big picture. Now, when you have a healthy balance of flora, you've got a lower risk of everything you see here on this slide. So a lower risk of HIV, HSV2, gonorrhea, chlamydia, pelvic inflammatory disease, and preterm labor. So these are all really important things to know. It's not when we have disruptions in the vaginal flora, when we have infections that affect the vagina, it's not just uncomfortable. It's not just an irritation for the person who's experiencing that. It is also really important in terms of long-term health and the risk of either contracting or having a flare or a recurrence of some of these conditions. So it's really important systemically as opposed to just a sort of local thing that you probably should deal with at some point. Now, we talked about how the strains of bacteria vary a little bit from person to person. L. crispatus, so the L here, the abbreviation is just for lactobacillus. So lactobacillus crispatus is one of the most common variations of lactobacilli that are found in the vagina. And it's actually very, very good at producing a lot of that lactic acid and keeping the pH low. So this is a very desirable type of bacteria to have. We also find some of these other species in vaginas. And we do know that some of these, for example, L. vaginalis and L. jensenii, not sure if I'm pronouncing that one correctly, but these two are found in healthy vaginas. But when people have infections such as bacterial vaginosis, the levels of these last two species start to creep up. So it's not just about which species are present, it's also about the ratio in which ones are present in which amounts. Each individual person has their own specific balance. So this varies quite a lot from person to person. We used to think that somebody would probably have very similar colonization as compared to anyone else in their household who also had a vagina. And recent studies are showing that that's not necessarily true, that there are some individual factors beyond just the environment that seem to affect a specific person's vaginal flora. We also know that there are a lot of variations globally, culturally, environmentally, and so forth. We know that people who are Black and Hispanic tend to have a more diverse set of flora in the vagina, and they often tend to have less of this L. crispatus, which some people think leads to a higher risk of bacterial vaginosis. We do know that bacterial vaginosis is more common in these populations, and it may have to do with the differences in vaginal flora. And there is also a difference in our immune responses to the flora that we have. So the immune system and the way that it responds to our flora is another important part of this picture. And of course, that has a lot of variety from person to person and sort of individual milieu as well. So what is so special about these lactobacilli organisms? We've already talked about how they lower the pH by producing lactic acid. So that's something that's very special. It's good to have these lactobacilli so that we can keep the pH low. We know that they are competing with other pathogenic organisms for both space and nutrients. So essentially, these lactobacilli can starve out some of the less desirable organisms. Anytime we have an opening to the outside, there is a potential for infection. We see that if we have a cut or a wound of some sort, there are lots of microbes floating around in the air, in the water, in anything that we're putting on or around our skin that can get in the body and can cause infection. So when we have holes, essentially like the mouth, the anus, the vagina, it's important for the body to have defenses to protect against whatever we might be exposed to. And colonizing with healthy bacteria is essentially a defensive move to say, well, if we're taking up all the space with these lactobacilli, and that prevents anything undesirable that we might get exposed to from burrowing in, getting a foothold, and starting to grow and potentially cause an infection. We do know that the lactobacillus can also aggregate with potential pathogens, which basically neutralizes them in some cases. And these lactobacillus organisms produce bacteriocins, which are essentially antimicrobials that are designed to suppress other colonies and other types of signaling molecules that can alert the body if there's an infection. If something starts to go wrong, you can have an upregulation of certain immune molecules. For example, the vaginal tissue is really high in dendritic cells, which are a type of immune cell that does a lot of signaling, activates the rest of the immune system, and so forth. So these lactobacilli are working in tandem with your immune system to make sure that if anything starts to get off track, everybody knows what's happening, that you can block out any potential pathogens and keep that vaginal environment really acidic. So very important that we keep these lactobacilli happy. I also wanted to just say a really quick note about vaginas in transition, because like I mentioned in the beginning, not everybody who is a woman has a vagina. Not everybody who has a vagina is a woman. And we know that the exposure to estrogen in particular, which happens around the time of puberty, when people start to menstruate, that exposure to estrogen seems to change the amount of glycogen that's being produced in the vagina. And that is what starts to acidify the vagina. And you'll have some shifts associated with that in the flora. It's not entirely specifically all related to the estrogen, but that is a big part of keeping the vaginal tissue healthy, is that exposure to estrogen as we go through menstrual cycles. So you're going to see some changes when people start to take testosterone if they are undergoing a transition. And one of the things that we'll see when people are taking testosterone is that the vaginal mucosa will become thinner. There will be less lactobacilli probably because there's less glycogen, and that's what the lactobacilli like to eat. And so if you don't have as much glycogen, there's fewer lactobacilli there, and the pH will start to go up. And that can expose people to an increased risk in infection and also in some of the STIs that we were talking about before. So you'll see this especially prominent up to 3 months or so after people start going on these testosterone-based regimens. And the changes will be up and down for at least 3 years, sometimes more, that people will be kind of finding their new normal. One of the things that some folks will do is just a teeny bit of topical estrogen in the vagina can help prevent some of this and prevent discomfort, infection, and so forth without interfering with the more systemic hormonal transition. And then you'll also see vaginas that are created via vaginoplasty. These are typically made from scrotal tissue or penile tissue, and that is skin. It's not mucosa. So the mucosal cells are a little bit different. You can think of that as, the cells on the inside of your mouth are a little bit different from the cells on your cheek. So one of the reasons that this is different is you'll have different bacteria that like to grow on the mucosal tissue versus on the kind of the skin. So if you have a vagina that's created from penile or scrotal tissue, then the microflora is a little bit less important in terms of maintaining that delicate balance, maintaining the proper pH, and so forth. So in a vagina where we've got lactobacilli as a key important issue, where we're trying to maintain pH and so forth, it's actually really important that we do not douche. That can disrupt the flora and actually cause more problems than it helps. However, if you have a vagina that is created from penile or scrotal tissue or other tissue, sometimes douching can actually be really helpful in terms of balancing the flora, cutting down on odor, infection, etc. So that's a little bit of a difference depending on the type of vagina a person has. So I just wanted to mention that as we go into some of these next phases. All right, so where do folks need help? What I'm going to be focusing on from here on out is people who were born with vaginas, because that is where most of the evidence and literature that we have is. I would love for us to have more evidence about all kinds of vaginas, and hopefully we'll have that data coming in the future years to be able to share more information about that. But from here on out, we're really talking about the folks who are born with vaginas and what we can do to support these people. So there's three main areas where, as nutritionists, I think that we have something to offer. One of them is in helping people maintain a healthy ecosystem and flora. We can help people with their membrane health, and we can also have a look at muscular and nervous system health, which is important in vaginal health as well. We'll start with the biggest one, which is the vaginal ecosystem. And what happens when the vaginal tissue starts to get, or the vaginal ecosystem in particular, gets imbalanced. So here are some things that can cause dysbiosis in the vagina in particular. Antibiotic use or dysbiosis in the gastrointestinal tract. Remember how we talked about how some of the colonization of the vagina is coming from the flora in the gut via the rectum and anus, and then we'll have just that really physical proximity. So if we have disruption in the flora in the gut, that can also translate to disruption in the vaginal flora. Certain spermicides and lubricants can disrupt the flora, and we'll talk about that a little bit more later on. Douching, which we've already mentioned, not a great idea in most cases because it is usually more harmful than it is helpful, even though it sometimes can feel like it's improving symptoms in the short term. Hormonal changes. We see this around the time of puberty, around pregnancy sometimes, and postpartum, and as well in the perimenopausal transition and postmenopause. Anything that's going to change the estrogen balance in the body systemically can also affect the vaginal flora and the composition of the flora. So keep an eye on that. Having a new partner or an increased frequency of intercourse. Essentially, you're just getting exposed to somebody else's flora. And if you have the same partner for a while, both of your bodies tend to adapt to the other person's, but especially in the beginning, it can take a little bit of time for you to find your new normal with that new exposure. Diaphragms, people are using diaphragms or really anything that's inserted into the vagina, especially if it's not cleaned properly. Smoking seems to be a risk factor, possibly oral contraception, again, depending on how it's affecting that person's estrogen levels and so forth. And then anything that's going to change the pH in the vagina. So remember, optimally, that pH is going to be relatively low. So things like semen, saliva, blood from menstruation, they all increase the pH in the vagina. Normally, most people are not going to have a problem there. However, for some people, especially if they've got some of these other exposures listed here, for example, if somebody has recently used antibiotics or if they've been going through a bunch of hormonal changes, et cetera, then the additional tweaking of the pH via exposure to semen or saliva or blood or what have you can be enough to kind of tip them over the edge and lead to symptoms. One thing I want to mention here that's a common myth that we'll see in the nutrition field is a lot of people feel like eating lots of sugar causes dysbiosis in the vagina. And there doesn't seem to be a lot of evidence at the sort of population level to support that. So a lot of times people will be like, oh, if you yeast infection, I need to cut way back on my sugar. Possibly for some people, maybe there is a mechanism by changing the flora balance in their gut and thus altering the vaginal flora. But on a universal level, it's not necessarily an evidence-based recommendation to say that people who have a vaginal infection need to cut back on their carbohydrate or sugar intake. Obviously, from a more general nutrition perspective, it does make sense to have a look at people's exposure to refined and processed sugars and things like that in general. But in terms of the direct connection here, universally speaking, it's not necessarily an evidence-based recommendation. One thing I like to share here for practitioners is that certain prescription medications and antibiotics will affect the lactobacilli in the vagina and elsewhere, and some will not. So we know metronidazole, for example, does not kill lactobacilli. That's one of the reasons that this is a commonly used medication to treat vaginal infections. So here I've just summarized a list of some of the common medications that may interfere with the lactobacilli in the vagina, that do interfere, or that we are pretty sure do not interfere. And that's just for your own use. I'm not going to go through each of these individually, but I thought it might be a helpful resource. By the way, I do have copies of these slides for you, and I'll share where you can get those at the end. So in case you're like, oh, I need to write all this down, don't worry, I will share the copy of the slides with you. So I thought I would go through a couple of the most common vaginal infections here because we see these a lot in our clients, and I thought it might be helpful just to have a little bit of background for you as to how you might approach these as a nutritionist. So bacterial vaginosis is the most common cause of vaginal signs and symptoms in people of, quote, reproductive age. So essentially people between puberty and menopause who have vaginas. Bacterial vaginosis is very common. I thought this statistic here was really staggering, that about 30% of women, this was in this particular study, they were specifically looking at women, have bacterial vaginosis at any given time. It does not always show up symptomatically. So some people have bacterial vaginosis without specific symptoms. In here, we can see that antibiotics are very helpful in terms of an acute bacterial vaginosis situation. However, in the long run, you'll see that we have recurrence up to 50% of the time over the course of a year. So this is this is when people start to get frustrated and they start to seek out additional support. They start to come to see us to wonder, is there something else that I could be doing? I don't want to have to keep going back in to get antibiotics. How am I gonna, how can I not keep going through this cycle? So the most common symptom in bacterial vaginosis is discharge that has a unique smell to it. Some people will call this fishy, etc. Now, bacterial vaginosis is not associated with redness, swelling, or pain. So if somebody is having any of those symptoms, either they have something else in addition to bacterial vaginosis, or they don't have bacterial vaginosis, they have something else. It is important, especially if people are having recurrent vaginal infections, to have a diagnosis, a formal diagnosis with an OBGYN, a midwife, a PCP, or somebody, because while regular old bacterial infections are common, as are yeast infections, there are other things that can be associated. For example, people who have diabetes, people who have autoimmune issues. There are some other things that could be going on, and you just want to make sure that you know STIs, all this kind of thing. You just want to make sure that somebody has the appropriate diagnosis because, of course, that will make a big difference. Now, one of the things that happens in bacterial vaginosis is that the pH of the vagina will go up. So instead of being about 3.5, it'll go up to more something in the range of 4.5 or even greater. So we see a lot of inflammation in the mucosa here. And one of the things that happens when people have bacterial vaginosis, there's actually more than double the risk of acquiring HIV if they have exposure to a partner who has HIV. And there is 3 times the risk of transmitting HIV to a male partner in the presence of bacterial vaginosis. So this is a really, this is a big deal. It's something to know about. It's something to address if it is present. We also know that pelvic inflammatory disease, inflammation of the cervix, and so forth can be related here. And another big thing is that people who have bacterial vaginosis during pregnancy are also at increased risk of preterm labor and preterm birth. So what we see here is really common. It's easily treated, but it often comes back if it's treated with antibiotics, and that there are increased risks associated with bacterial vaginosis beyond just having an odor that's unpleasant. So what can we do to support these folks? Well, one of the biggest things we can do in terms of our evidence base is to help people by using probiotics. One of the key things with probiotics, and I imagine a lot of you know this, but I'm going to say it anyway, just to be sure we're all on the same page, is that probiotics are not all the same. So you can't just say, oh, take some probiotics, because there's a difference in the way that probiotics work in the body based on both the species and the strain. And so when we're going to recommend probiotics, we need to say a specific type of probiotic for somebody to look for that has the specific strains that have been studied for whatever it is we're trying to support somebody around. So in the case of bacterial vaginosis, the most support in terms of the clinical trials and literature out there is for Lactobacillus rhamnosus GR1 and Lactobacillus reuteri RC14. So these are the specific strains that you want to look for as a first line if you're trying to support somebody with bacterial vaginosis. Now, there are two products that I know of. Actually, there's one more, which I came across recently, and I didn't make it into the slides, but I will just tell you. But two products that have these specific strains are Geros Fimidophilus. That one comes in a shelf-stable version and a refrigerated version, so just make sure you know which one you're getting so you can advise your client as to whether they need to refrigerate it or not. And Integrative Therapeutics ProFlora Women's Blend also has these specific two strains. And the other one, I might have to put it in the resources, but there is another one that has these two strains in. Oh, here it is, Refresh Pro B, with the F is PH instead of an F in Refresh. So those are three options that you could look for in terms of probiotic support. Now, do we know how effective these are? The studies are very mixed, both in terms of whether these particular strains can prevent bacterial vaginosis in people who are at risk of recurrence, and in terms of whether they can cure or treat bacterial vaginosis directly in somebody who's experiencing symptoms or an active infection. In some cases, they seem quite effective. In other cases, not so much. I suspect that this is for a couple of reasons. One, because the species that people have naturally are different, and there are probably some people whose particular flora responds really well to these particular two strains, and there are probably some people who have a slightly different baseline composition that may not be responding to these two as well. It may also have something to do with the quality of probiotics that they're using. As we know, labeling is questionable in some cases, as is quality storage, et cetera. So that can be important to make sure that people are getting good quality products that are what they say they are on the label. One of the things that I will often do with my clients, if they're not responding well to this, especially if this is somebody who has a recurrent infection, it keeps coming back, they keep having to go on antibiotics, it's like, oh, and they're not seeing the kind of results they're hoping to see on one of these two products, sometimes we will switch it up and just try a different blend. For example, Megaflora and Innate Response both have some products that have L. brevis, L. plantarum, some of these other species that have been not quite as well studied, but there is some evidence suggesting that these may work. So the Innate product I use there is called Flora 5014, and then there's also Megaflora, which is by Megafood. So those are sort of like second line options that I might consider for people if these don't seem to be doing the trick. A question that I get a lot is, well, should these be taken internally? Should they be used as a suppository directly into the vagina? Like, what are we talking about here? There are different studies on, different routes of application. As of right now, what I have seen is that most of the evidence is really leaning towards oral supplementation being more effective than vaginal supplementation. This is probably due to the mechanism of changing the gut flora and or changing the gut flora, possibly tweaking the immune system systemically, or we've got that direct connection between the flora in the gut, in the colon in particular, and the flora in the vagina. So I tend to have people do oral supplementation as opposed to vaginal in this case. So some other things that you may want to consider, herbally speaking, as an herbalist, I always like to throw this in here, is that we talked about the internal or the topical vaginal route when it comes to herbs. When it comes to herbs, as I said before, don't douche. We don't recommend a douche, but sometimes people will like to do a sitz bath or even a peri bottle, just a gentle rinse with a peri bottle, which, if you don't know, is basically like a flexible water bottle with a squirt top, like you'll sometimes see on liquid detergent. So you can just kind of squirt the whole external introitus, the opening that leads into the vagina. And sometimes you will have topical relief there that feels good while you're also working on support with probiotics. So I will sometimes do both depending on what the client's interested in, their ability to, follow through on some of this and so forth. You will often see people advising using garlic just a garlic clove. Topically, by topically, I mean inserting it into the vagina when people have an infection. The evidence for that is scanty. I do think that it potentially makes sense to use some garlic internally in terms of supporting the immune system. There are some antimicrobial compounds and that sort of thing that I could see a theoretical mechanism there. However, I don't recommend using garlic internally in terms of, as a suppository, essentially in the vagina. I think you're potentially running the risk of further disrupting the flora and or irritating the mucosa that's already inflamed with some relatively harsh secretions from the garlic. So my preference is that if somebody does want to use garlic, that they go ahead and just do it internally, either by loading up in their food or potentially taking a supplement if that's what they want to do. Some topical herbs that I do consider are green tea. There's some interesting evidence about green tea disrupting biofilms, which can be a factor, especially in recurrent vaginal infections. Thyme, calendula, sage, rose, and plantain are all things that I might consider topically. I have thyme, calendula, and sage. They have a little star next to them because those are not appropriate for internal use when people are pregnant. So I just wanted to highlight that in case, that was relevant for folks. But all of these, the way that I would use them is to have people make a really strong tea and then do a sitz bath where you're essentially submerging the pelvis and soaking it for a little while, or to put it in a squirt bottle and really gently squirting the introitus, the labia, etc. That can provide a little bit of topical relief for people. Again, we're not going for pressured squirts into the vagina. That's not what we're aiming for here. And then for oral use, I think all of the same make a lot of sense, from the antimicrobial, soothing, calming approach. And then I do sometimes use garlic and some of the medicinal mushrooms, such as turkey tail, reishi, etc., to see if we can support the immune system in folks who are having chronic and recurrent vaginal infections, the same we would if people were having any kind of long-term or recurrent infection, to see if we can help the immune system find some balance as we address it. This is just an interesting study I wanted to share with you. It's just one study, but I do think as people who deal with vitamins and minerals, that we might want to be aware of this. So this is from Krasnopolsky and colleagues from 2013. They essentially looked at vaginal insertion of slow-release vitamin C capsules versus a placebo capsule once a day, just for 6 days after menses, versus placebo in people who had bacterial vaginosis. And a lot of times in people who have recurrent BV, it will come back after menses, probably because of that pH change that we already talked about. So the idea here was that if we can use vitamin C to potentially keep the vaginal environment a little bit more acidic, that's the proposed mechanism. Is that what's happening? Actually, we don't know, but that's the idea here. So I thought, well, if we try to acidify the vagina a little bit after menses, might that help in prevention? And you will see here that after 3 months, there was not a big difference between vitamin C and placebo. There was no statistical difference, although placebo had a few more cases of relapse compared to vitamin C. But after 6 cycles, I should say, you'll notice that there was a significant difference in the relapse in vitamin C versus placebo. So the people who were doing the vitamin C had a lower rate of relapse than those who had the placebo. So I thought that was interesting. It's a slow release 250 milligram vitamin C capsule. Is it worth trying? I don't think it would be my first line of action, but especially if somebody seems to be having a recurrence after menstrual cycles, it might be worth considering. I should say that all of these are things that can be done in conjunction with antibiotics or whatever treatment the person's primary care or other practitioner is recommending. These are not necessarily things that are only done instead of. They can be done concurrently, of course, with working with the other practitioner as needed. And then I also wanted to briefly mention vulvovaginal candidiasis, or candida, as most people will say this, or a yeast infection. This is another really common vaginal infection. So Of people who have a vagina, up to 75% will have a yeast infection at least once. Typically, this is due to Candida albicans, which is a yeast. However, there are other species that can cause candidiasis, so it's not just Candida albicans. And again, recurrence is really high. So people who have one episode, there's almost a 50% chance that they will have another episode within a year. I can't remember if it's 6 months or a year, but something in that range. In the case of a yeast infection, you will have some of these symptoms, burning, itching, redness. There's a lot of discomfort, and the discharge does not have an odor. So that's one of the key differences. In this case, we have Lactobacillus staying dominant. So we noticed that there was some alterations in the proportions of lactobacilli in the bacterial vaginosis. Here, we still have relatively high proportions of the quote healthy lactobacilli, but we also have this sort of infection on top of that with the Candida albicans. So let us talk about treatment strategies here. So the common sort of medical treatment is fluconazole. It's very effective, but as we mentioned, recurrence is really high. Probiotics are less effective or promising for yeast infections than they are for bacterial vaginosis. So it's hit or miss with the probiotics. They're very helpful for some clients, and for other clients, they're not really as helpful as we might hope. Still, I think worth a try. In the cases of yeast infection, L. rhamnosus GR1 does have some reasonable evidence, although it's still preliminary, as does boric acid, 600 milligrams externally into the vagina, either once a day or twice a day for a week or two. This is most helpful in recalcitrant yeast infections. This is something to try if people are, going through fluconazole or similar and still not having relief. It can be worth trying boric acid, and that's something that people's OBGYNs or primary care may be recommending as well. The boric acid, we used to think it's working by acidifying the environment, but it actually may be more working via antimicrobial mechanisms. So it's still up in the air how it's working exactly. There is a chance that the boric acid is actually damaging the healthy flora as well. So that's why it's not necessarily the best thing to do right off. It's my experience that a lot of times people who have a vaginal infection are in the kind of burn it all down mode. They're like, let's just make it go away. So there's a feeling that people want to do something aggressive, like, oh, this is really not okay. Let's just fix this. But we want to make sure that we're doing it as gently as we can so as not to disrupt the healthy flora and potentially lead into this cycle of recurrence or renewed infection. Some other species that do have at least some evidence here are listed here, the Acidophilus LA5, Fermentus FL10, and so forth. There are not a lot of supplements that I found that have these specific ones exclusively, although you will find some that have one or two of these strains in a combo. I do think it makes sense, like I said before, to start out with that Femtophilus or the Proflora, etc. Try that. And then if that's not helping, you can go on to try some other probiotics that do have at least some supporting evidence. In terms of what else you can do to support folks when they're having especially recurrent issues, what I do is very similar to what I might consider for people who have bacterial vaginosis. In the case of yeast infections, yogurt can also be reasonable to consider topically. It can be very soothing. Again, you're really just doing this on the labia or potentially kind of mixing up a little bit of yogurt in some tea or some water and using it in a peri bottle. There is an interesting study here that Darvishi and colleagues from 2015 looking at a mixture of yogurt and honey being quite antimicrobial, topically for 7 days was as effective as standard treatment. So that's kind of interesting. I do have a list of all the references for y'all as well, which I'll share towards the end. And there are some just kind of one-off studies looking at creams or suppositories that have dill, curcumin, and sage. I have to tell you, the curcumin topically strikes me as, I've never used that with a client because it stains. You're getting into a lot of situations with underwear, sheets, etc. So I'm not sure curcumin would be my first choice here, and I just wanted to throw it in there in case you wanted to consider it or look up some of these studies. I will also mention that the itching we see associated with yeast infection is a histamine response. So anything that you're going to do to lower histamine, to include like over-the-counter antihistamines or anything else that you may use as a nutritionist, will help. It won't help the infection, but it will help the symptoms. So that is worth considering. And then, as I've mentioned, we do want to think about immune function for people who are having recurrences. We want to think about the colonization of the flora, but we also want to think like, okay, is the immune system overreacting? Is there something going on systemically that may be causing this? Anyone who's pregnant should be absolutely getting prescription treatment for this. Sometimes they can do some of these things in addition, but sometimes you'll have people who are like, oh, I want to try the probiotics and some of this other stuff first, and then I will take the, antifungals or antimicrobials if it doesn't work. That's not really a good strategy in pregnancy because of that increased risk of preterm labor. So we really want those folks to go in and get standard treatment, their prescription treatment according to a PCP or OB or whoever. And then if they want to do some of this in conjunction, great. I will also mention that anybody who has extreme, severely suppressed immune function, such as coming off of chemotherapy or any kind of transplant, anything like that, those folks should not be taking probiotics. Generally speaking, probiotics are very, very safe. However, if people do have extremely suppressed immune function, you can potentially cause a systemic infection by taking probiotics. It's not common. It's not something that most people need to worry about. But as practitioners, I do want you to just keep that in mind, that that's a special case and you would want to, not go with the probiotics and those ideas. So overall, I just wanted to sum some of this up here for you. So if somebody does have a vaginal infection, here are some of the things that I might consider if they want to try some of this alone, or if they want to do some of this in conjunction with metronidazole or whatever else they're being recommended. I would consider an oral probiotic daily for 7 days, and then at least a couple times a week for a few months after that as a preventative measure. Like I've already told you the specific brands that I tend to use. I don't have any association with these brands. These are just the ones that I found that I use with my own clients. If somebody is resistant to standard treatment, if they're having recurrence, etc., then it may be worth considering boric acid or vitamin C vaginally at night, especially 1 week after menstruation. I think that that's a potential thing that you could consider. You could consider an herbal rinse or a sitz bath nightly or a few times a week. These are kind of a lot of work. So, not everybody's going to do these nightly, but at least a few times a week. And you could add in a little bit of yogurt as a cream, as a topical cream for people who have yeast infection. And then I would consider a custom herbal formula in many cases for internal use. And then I also wanted to mention that you want to ask about some of these lifestyle things. So for example, condoms, if there is lubricant or spermicide on them, sometimes that can be irritating to the vagina. However, folks who do have recurrent infections, if they have a partner with a penis, using a condom is a really good idea because sometimes people are passing these infections back and forth. And so using a condom while you can get the flora balanced in one person can be very, very helpful. You also want to look at any sex toys, essentially anything that's going in the vagina is, any creams, lotions. If people are using a douche, you need to talk to them about that. Anything along those lines, you want to be having a look at that and making sure that, for example, sex toys need to be cleaned properly. You need to make sure they're not old and breaking down. You want to look at your standard things like stress and hydration, the things that we do to keep people healthy, just in general. So those are all important things to consider. We're just going to spend a few minutes here wrapping up these last two. Fortunately, probiotics was the big chunk of things, but I did want to spend just a minute talking about membrane support. So we talked about how the vagina is lined with a mucosal membrane. And one of the things that we find is that during the perimenopausal transition, vaginal dryness and discomfort is really, really common. So we'll see that dryness and discomfort is present in many people, but not super common before menopause. So about 15% of people might experience this before menopause, but up to 60%, it's 57 here, people are going to experience some vaginal dryness and discomfort after menopause or during the, starting during that perimenopausal transition. So some causes in folks who are still menstruating would be, hormonal disruptions such as hypothalamic disruption, excess prolactin. People are lactating. Sometimes that will do it. Certain prescription medications, etc. We talked about how testosterone can suppress estrogen, and one of the potential symptoms is vaginal dryness and discomfort. It seems that anytime estradiol is lowering, you're going to have thinner tissues. It's going to affect that mucosa. You're going to have less flexibility. There's going to be less glycogen. Thus, the pH will go up. Cervical fluid is not as abundant because that is estrogen dependent as well. So you can wind up with microtrauma, which can lead to further pain, discomfort, and you can wind up with a sort of vicious cycle going on. Unfortunately, this vaginal dryness and discomfort does not tend to clear up after people go through this transition. A lot of our perimenopausal symptoms do tend to resolve after you kind of make it through that 8 to 10 year period, then you sort of re-stabilize. But this one does not as commonly resolve. So it does help to have some kind of treatment and to be asking people about it. A lot of times people are like, well, that's just part of perimenopause. Good luck with your new normal. And that doesn't need to be the case. It's outside of our realm of expertise, but I will mention that low-dose topical estrogen can be very, very helpful and can prevent some of this from kind of being a long-term process. So that's something for people to speak to their gynecologist about, or their midwife, or whoever else they're using. So what can we do to support folks with vaginal dryness, supporting membrane health, and so forth? There is a myth that vaginal tissue is like a use it or lose it, and that you need to be, having sex or stimulating and this kind of thing, or else your tissues will dry up and they'll never be okay again. No, that's not true. There's no evidence supporting that. Although certainly, use it as much as you like. There's no minimum and there's no maximum within your own personal comfort range. Just want to clear that up as a myth. But we do want to look at stress levels. We know that when we have vaginal dryness and discomfort and microtrauma and tearing, it hurts to have sex or, these other types of things. And that can cause a vicious cycle. Then you tense up, then you've got stress levels are higher. And then the next time you go to try to have sex, it's worse, and so forth. So we can support people in terms of stress management with our nutrition and herbal interventions. There's some interesting evidence with fennel being very mild phytoestrogen. So we can, there's some interesting studies on fennel creams being helpful for folks. So that is something to consider. I also really like rose as a kind of internal and topical herb for the perimenopausal transition. There's not very much evidence in support of it, but just on an energetic level, I find that rose is calming and nourishing for folks. Some people find that coconut oil or other oil-based lubricants can be helpful on the vulva, regardless of whether any sex is involved or not, but just to keep the tissue moist. There are some lubricants that are designed to be used really as moisturizers, I should say. Good Clean Love has a good one that people can use. Again, not necessarily associated with any kind of sex, but just as a moisturizer for this tissue. You do want to look at circulation. So anything that's going to impair circulation to the pelvis can potentially exacerbate. It's not going to be a direct cause, but we want to look at, are people doing a lot of sitting? Can we get folks to be moving? Can we increase that pelvic circulation? And then we want to really closely look at any lubricants that people are using. Absolutely, they should be used. That can really help prevent some of the microtrauma and the pain and that kind of thing. However, there's a lot of really crappy lubricants on the market. We want a specific osmolality because essentially if you're using a lubricant that has the wrong osmolality, you're drawing water out of the tissues and drying them out further. So it feels lubricated in the moment, but actually you're making things worse in the long run. So you need a specific osmolality, ideally not more than 380 milliosmoles per kilogram. And then we also want a pH that's appropriate for vaginal use. So if people are using a lubricant for any kind of vaginal activities, you want somewhere in the 3.5 to 4.5 range. And if it's for anal use, you need something closer to 7, and they're not interchangeable. You don't want to be using the same lubricant for these different activities. So this is a very interesting study from Edwards and Pene in 2016. This, of course, does not have all lubricants on it, but I did just pull out some of the ones that they did look at, and you'll see that essentially only these ones down here in the clear, the clear white bar have the optimal osmolality. And all these other ones are not optimal for vaginal use. So directing people towards some of these might be reasonable. And then here's the same type of chart for pH. And you can see that there's two ranges. This one, at the lower part of the chart, is appropriate for vaginal use, and then these up here are appropriate for anal use. So it's good to ask people about these. It's a delicate topic. It doesn't always come up, but this can make a huge difference, because if somebody's using a lubricant at the wrong pH or at the wrong osmolality, they can be exacerbating dryness, and it doesn't, like I said, it doesn't tend to resolve on its own. And then lastly, we do want to look at the muscular and nervous system support surrounding the vagina and the pelvis. So if people are having pain, especially associated with perimenopause or other types of vaginal symptoms, we do want to think about the pelvic floor, which, as you can see in this image, is the vagina is passing through the pelvic floor. And so if people are having pain with intercourse, if they're having spasm, all these types of things, it can be very, very helpful to refer them to a pelvic floor physical therapist. This is a very specific type of physical therapist. I think any nutritionist who is working with people around anything related to the pelvis needs to have a pelvic floor physical therapist in their referral list, because this is a very specific skill set. These can be very, very helpful in working with people who have constipation issues as well, other types of bowel things. So find yourself a pelvic floor PT if you don't already know one. And then also helping people kind of get to some of these patterns. That the pelvic floor PT will work on this. But if we're finding a pattern of spasm or pain, sometimes we've got this vicious cycle, and helping people kind of relax and work through this, referring them out as needed, can be really, really helpful in supporting vaginal health and sexual health overall. So to wrap up, as with all of our clients, we want to make sure that the foundations are in place. We want to look at their diet, their sleep, their stress, and their hydration. The reason that these are particularly important for vaginal health is because we talked about how that mucosa is rapidly transitioning tissue. And we know that we need, for example, lots of B vitamins. We need to have solid nutrients available to fuel that transition. So we want to make sure people are getting plenty of micronutrients, that they're eating enough calories to maintain a healthy reproductive cycle if they are in their menstrual years. And of course, we want to make sure they're eating enough calories all the time. But we want to make sure that stress levels are good, hydration is solid. We want to do a double check on anything that's going in or around the vagina or the labia. So any kind of detergents, soaps, creams, sex toys, partners, all of that. Check any kind of emotional or spiritual connections. Ask about vaginal health. I think some of us may need to review intake forms and just make sure that we are asking people, are you having vaginal dryness? Are you having vaginal infections? Are you prone to recurrence? These are things that we want to ask people about, because sometimes they are not comfortable sharing them if we don't ask. And then we want to look at supporting circulation, systemic integrity, and tissue integrity for all of these clients. So that's what I have for you today. I thank you so much for being here and for listening. I have posted all of the slides, the references, some resources, and a way to contact me on this website, CamilleFreeman.com/ANA. So if you have any questions, if you have anything you'd like to share for me, if you have something you think I've said totally incorrectly and you'd like to correct me, I'm very open to that. I love learning about this. So please feel free to be in touch with your questions, your suggestions, sharing of information, etc. And I hope you have enjoyed the presentation.